A couple of follow-on questions to that, because this is just fascinating and my mind is just absolutely lighting up right now. On the low versus high concentration, and I'll link to your papers in the show notes, is there an approximate cutoff between, what is low versus what is high? And I guess in high doses, you already mentioned what could potentially happen to people.
Yes, yes. It is what we call is a curve that goes up and then down. So if you have down the concentration of methylene blue, and up you have, for example, the activity of cytochrome oxidase or oxygen consumption. When you start with the low amounts, you start increasing oxygen consumption, cytochrome oxidase activity. All of these are beneficial effects until you reach a concentration, that's a peak. And from there on, if you keep increasing the concentration of methylene blue, the opposite starts happening. You start going down in oxygen consumption, down in cytochrome oxidase activity. So sometimes this is referred to biphasic response.
Got it.
Low levels produce an increase in the response. High levels then produce the opposite effects. The pharmacological term is hormetic dose response, or the phenomenon of hormesis. And so where is that cutoff? That cutoff you can measure in different ways. If you have in vitro, you can have homogenates of the brain, and then you can measure the molar concentration there. But if you want to translate that into an organism where you can inject an amount of methylene blue based on the weight of the animals, then in our experiments, and we tested many of these, it is between like a 0.5 milligram per kilogram of body weight to about 4 or 5 milligrams per kilogram of body weight. When you are there, you are in this beneficial part of the curve. The amounts that I gave you are in the top.
Yeah.
In the top is where you have the 0.5 milligram to the 5 milligram. Before that, the lower amounts are still beneficial, but they're just not reaching that peak.
Okay.
And after that 5, you start going down. You still may be beneficial, but you're going to reach a point where you're going to go below baseline.
Yeah.
And it will do the opposite. It will become a poison. It will become a killer, because it is grabbing your oxygen. It's directly grabbing the oxygen, and it's not allowing the oxygen to be reduced from water. And this, unfortunately, there are some people who don't understand this biphasic effect.
Yeah.
The majority of drugs, not just methylene blue, have a biphasic dose response, in which low doses produce the opposite of high doses. And this works both ways. What do I mean? If the low dose is, you can have a situation, and other phenomena like radiation follow the same hormetic behavior. Let's say cancer cells that are irradiated to kill them. Well, at a high dose, that irradiation kills the cancer cells, but a low dose of irradiation, it promotes formation of cancer cells. So it works both ways. You can have the beneficial effect being at the high dose, or the beneficial effect being at the low dose, depending on what is the intervention. In the case of methylene blue, is the low dose what produces the beneficial effects.
So I wonder if, just hypothetically here, if let's say somebody had a compromised Krebs cycle, for instance, with mercury poisoning, could methylene blue then substitute for the electron donor at the end of that? I guess it would, wouldn't it? Or independent of what's going on up top in the Krebs cycle?
It could be happening at many different points, not only in the Krebs cycle.
Yeah.
The answer is yes.
Mm-hmm.
If you don't have, you're interfering in this case with the formation of the electron donors, and we have tested these in animals in numerous ways. Yes, methylene blue becomes now a replacement. And you can also have, for example, inside the mitochondria, you can have an inhibition in the electron transport chain. At any one of these, there are four main transferring stations. They're called enzymatic complexes, or mitochondrial complex 1, 2, 3, 4. 4 is cytochrome oxidase.
Mm-hmm.
If you inhibit the activity of any of those complexes, you cannot progress effectively the electron transport. So
Mm-hmm.
we can do this, and these chemicals that do that are what we call metabolic poisons. For
Mm-hmm.
example, what is the most classic poison historically that you can think of? The ones that you remember, the philosophers were taking it.
Like rat poison or cyanide or something like that, right?
Cyanide.
Mm-hmm.
The Russian spies supposedly had it in their rings.
Mm-hmm.
Take it up, and very quickly they will die. How does it kill? What does cyanide does? Cyanide inhibits cytochrome oxidase.
Mm-hmm.
When you inhibit cytochrome oxidase more than about a third of its activity, you die. As simple as that, because you can no longer use oxygen.
Mm-hmm.
But what about if methylene blue is there at a low concentration inside your mitochondria? It can bypass that phenomenon and directly donate electrons to oxygen. The electrons that couldn't be donated by the inhibited cytochrome oxidase now. So methylene blue is an antidote in emergency rooms.
Mm-hmm.
Methylene blue is listed by the World Health Organization as one of the essential medications in human history that should be available. And it supposedly should be available in every emergency room around the world. So if you have any kind of metabolic poison, like I gave the example of cyanide, but you can have, for example, we use in our experiments a lot of, one is called rotenone, and inhibits complex 1. The same thing happens. Rotenone prevents flow from complex 1, so it allows only starting from complex 2, which is the smaller component, but you can bypass that by providing electrons through back to the electron transport from methylene blue. So you can prevent the cells from dying by using this process. And right now, the most common application, and the only one that the FDA mentions here in the United States, unfortunately, is cytochrome oxidase it has to grab oxygen to be able to catalyze this reaction. So the way it attracts oxygen is the same way that hemoglobin inside your blood attracts oxygen. It has a group that is called the heme group that in the center has an iron. You know that oxygen and iron are attracted because it oxidizes the iron. So it is like a glove, in a baseball.
Nice.
that oxygen can be catched. Well, you have a heme group in a hemoglobin. That's where the name comes. And hemoglobin has it there, but hemoglobin only transports the oxygen inside your blood. But where does it transport it to? Who is the one who's going to catch that? That's cytochrome oxidase. So that oxygen is going to have to go from hemoglobin to cytochrome oxidase. That transfer. And this process of transferring can be interfered by you blocking the cytochrome oxidase or by you blocking the hemoglobin. So for example, if you have carbon monoxide, it's similar to oxygen. It can occupy the same pocket here and interfere with oxygen binding. You can have other compounds, for example, nitrites, that can do similar, a whole series of compounds. When hemoglobin cannot carry oxygen efficiently, you end up with something that is called hemoglobinemia.
Oh, wow.
In this condition, what means is the hemoglobin in the blood, because you have a poison, a metabolic poison, you're interfering with this carriage. So what is the only way that you can fix this? The only antidote that prevents, like kids here in the US, kids go to the baseball game. They, a little kid, 4, 5 years old, eats several hot dogs filled with nitrites. Has preservative. These nitrites get into the circulation before the ball game is finished. The little kid starts turning blue, cyanotic, turning blue because there is less oxygenated hemoglobin, which is red, as opposed to deoxygenated hemoglobin that is blue. They take it to the emergency room. The only thing they can get the kid that will prevent the kid from dying is methylene blue. Methylene blue prevents the so-called methemoglobinemia. So it is used as an antidote for any metabolic poison that is affecting the transport. So in that case, you want to get the methylene blue inside the blood directly. So you inject it intravenously so it can target. The methylene blue will have more affinity for that pocket, and it will liberate, will compete with the poison, and it will allow the hemoglobin to be released. And, so it is a lifesaver, but it is being only used primarily for this acute antidote. However, if you give it a low dose chronically, it fights toxic compounds that may be interfering with the transport of oxygen, but also with the utilization of oxygen by cytochrome oxidase inside the mitochondria. So it has the benefits on the two ends. And this is why it's so useful for so many different things. But I can give you a historical account of some of these things if you want.
I want to double click on some of the broader benefits of methylene blue, because I've used it in the context of focus. I've also found, and I speculate that this is the antifungal nature of it, it's had a unique positive effect on my gut. But are there the cognitive benefits, is that predominantly through the mechanisms that we just discussed with cytochrome oxidase?
Yes, the cognitive benefits are primarily for facilitating the energy supply to the brain, so that you can obtain more energy. So we have done acute experiments in humans. We first do it in animals, and we show even healthy animals, we could improve their memory performance. by low dose methylene blue. At the beginning, I thought I was only going to be able to improve the memory in an animal who had a deficient memory because of an intervention. One of these toxic compounds that I told you, like cyanide, a very low dose, or rotenone, will produce learning and memory deficit. And methylene blue will neutralize that, will bring the animal back. Like in that uh, study that you mentioned that we recently published,
Yeah.
there, instead of giving the animal a toxic compound, I try to simulate one of the processes that is the most uh, consistent process that happens as we grow old. And that is that we have a chronic hypoperfusion to the brain. That is, our circulatory system becomes compromised and we perfuse less blood to the brain. By doing that, we provide less oxygen and less nutrients to the brain. So the question there is a lot of epidemiological data and clinical data suggesting that this problem with the vascular supply to the brain is related to the cognitive decline that happens as people grow older, but also with dementia, what we refer to as geriatric dementia. Geriatric dementia includes all of these types of dementia that happen in old age. Right now, what I was telling you is with the methylene blue, you can facilitate memory when there is a deficiency, but also in a healthy animal. And in the case of the study that I was building up to, we knew there is a lot of evidence now that this vascular compromise precedes and causes a lot of this cognitive decline. But how can you demonstrate this? You cannot produce this in a person experimentally under control conditions. So we decided to do it in animals. In animals, you can ligate the carotid arteries that the main supply of blood to the brain is coming from. But you can do it in a way that you allow collateral circulation so that it's only a partial decrease, simulating what's happening as you grow older. Unfortunately, after 45 years of age, every year after that, you have a slight decrease in the perfusion to your brain. Your cardiovascular system compensates. It's called autoregulation by the heart pumping harder, so your blood pressure starts increasing, so you can get more blood to your brain. But that process reaches a point that it can no longer compensate for that hypoperfusion. And so you can do that in the animal by this ligation. And then we gave them, we maintained this for 1 month, and we gave a control group the saline vehicle, the inert solution injected, and in the others, the low dose methylene blue daily injected. And sure enough, the animals can maintain the memory function, whereas the other ones have a memory impairment. And if you look at the brains after 1 month, you can also prevent the neurodegeneration that is happening in the brain by this chronic low-level methylene blue treatment. And this is not the only time that we've done this in terms of facilitating memory and preventing neurodegeneration. But this was the first time that we did it with a hypoperfusion model. In other words, with one change that we know is one of the major factors contributing to the geriatric or old age cognitive decline and dementia.
So I guess the next question is because it sounds like you have something brilliant here, and it's a very elegant and candidly probably cheaper solution in order to deal with one of society's largest problems, which is neurodegenerative decline or disease. Uh,
So,
how do we move from, in
well,
vitro rat studies to humans?
well, we did some of the human work
Hmm.
already because we wanted to prove that it's safe, and we wanted to prove that it can improve memory in humans. We've done that in 2 studies already.
Hmm.
Uh, Giving it to humans, we map using functional MRI the effects of methylene blue in the human brain. Uh, and we shown that you can improve cognitive testing. Uh, it's So what is stopping us? Methylene blue has been used for over 120 years. It's a lifesaver.
Hmm.
Uh, the concentrations that we need to use are the same low concentrations that are used in the emergency room for an
Hmm.
acute effect to prevent uh, metabolic toxins from damaging uh, or killing someone. Uh, so what is stopping this? Well, follow the money.
Yeah, that's what I was going to say. You can't patent something that's been around for over 100 years.
No pharmaceutical company, and I had
Hmm.
tried. When I first started doing this work, there was a company in the US that was making methylene blue, and it was in pill forms. There were pills of 65 milligrams,
Hmm.
which would have been equivalent to, in a 65 kilogram person, it would have been equivalent to 1 milligram per kilogram, which would
Hmm.
have been fine. They were actually widely used in the US many years ago for a different purpose. And
Hmm.
I can also explain that all the purpose because related to the other point that you brought in. But let me explain that and then go back to the issue of the pharmaceutical. Uh, in the US, that compound, that company is no longer around, was called Urolene Blue. It's just a name for, they gave to methylene blue pills.
Hmm.
And urolene sounds like urine, urinary bladder. The
Yeah.
reason for it is that the way your body doesn't break down methylene blue uh, to any significant extent.
Hmm.
So it is essentially all the methylene blue that you ingest is removed from the circulation through the kidneys. It goes into the bladder, the urinary bladder, and you urinate that back out. In about 12 hours, half of the methylene blue that you consume with this low level uh, doses, it's excreted out. You
Hmm.
pee. So that's why when you pee, after you take methylene blue, you pee blue
Yeah.
or bluish.
Hmm.
It depends. It depends. It could be green. If your urine was yellow, then the blue and the yellow makes it green. If your urine was clear, then it's more bluish. So a whole range of it discolors the urine. This So what does this mean? It means that after you take a dose of this over time, let's say these first 12 hours where half of it gets into your bladder. So the bladder gets a high concentration. All of that is should have been distributed through your body gets concentrated in your bladder. And what happens when methylene blue is a high concentration? It's just the opposite of the low concentration.
Hmm.
It becomes a killer. It becomes a pro-oxidant. So if you have microbes in your bladder, like in an urinary tract infection,
Yeah.
then it kills the microbes. So Urolene Blue was used as a treatment of choice for urinary tract infections.
Mm-hmm.
You know, like older people, especially older women, have recurrent urinary tract infections because they allow the urine to remain in the bladder for too long because of the changes that happen in your ability to urinate over time as you grow older. So when the antibiotics became popular, then this treatment was changed, and doctors were no longer taught about methylene blue, and they prescribed antibiotics for
Mm-hmm.
urinary tract infections. And then people, especially older people, were for 1 month taking antibiotics to relieve that. Of course, having other debilitating effects by damaging your intestinal flora, for example, with the antibiotics. Uh, and unfortunately, they will be free for a couple of months or so, but if their urine concentrates there for too long, they get reinfected with
Yeah.
their own bacterial flora. So this this is a problem that already has a solution, but that company uh, closed down. It couldn't compete with the antibiotics. The physicians wouldn't prescribe it, even though it was a better treatment, and it
Mm-hmm.
didn't produce these other side effects. Uh, and also for another reason that I'm going to get to that is more sinister. uh, and
Mm.
Now that all of this information that we have been working for many years about methylene blue was being out, other people have been trying to use this. There was a group from the UK that found that methylene blue uh, in vitro uh, uh, could prevent the phosphorylation of tau. And
Mm-hmm.
then they created a company that has part of their name with the same word. I'm not going to mention the name.
Mm-hmm.
And this company is being promoted as an anti-tau treatment using methylene blue. Well, what happened? They realized they couldn't patent the methylene blue, so they come up with a simple derivative, which is not really a derivative. They just had a reduced form of methylene blue. When methylene blue is reduced, it's called leucomethylene blue.
Yeah.
Leuco means transparent or
Mm-hmm.
white. Uh,
You see it in
because when it's
skincare
reduced,
sometimes, right?
huh?
You see that with skincare sometimes, right?
Well, the leucomethylene blue, well, let me explain. That's a different one. The leucomethylene blue means it's reduced, it's transparent. Uh, However, that's the form. Whenever methylene blue gets into your body, it cannot go across the cell membrane unless it's reduced into leucomethylene blue. So your body all does that naturally.
Mm-hmm.
Uh, but anyway, that company make the leucomethylene blue, and they have been doing clinical trials with Alzheimer's patients. And unfortunately, because they believe in vitro, the more methylene blue you have, the more you interfere with this tau phosphorylation. Then they believe the more you have, the better. Uh, and
No dose dependent curves discussed there.
Yeah, and believe me, I know they know about my work, and but they don't want, because they already patented this leucomethylene blue as having a different mechanism of action than
Mm-hmm.
what I've been talking about here. So, of course, when they started doing this with the higher doses, this didn't help.
Mm-hmm.
It became counterproductive. So some of their experiments, they gave very small amounts of methylene blue, and it turns out the people, the demented people who were benefiting, were the ones getting the very low dose that they were using as a control, uh, just to get the urine blue. We're giving them this small amount, and the ones that are giving the doses that in vitro had the more effect in interfering with the tau phosphorylation, they were not benefiting, they were worse off. And so that company is being coming up with all kinds of ways to try to explain these that are frankly have no scientific basis. And unfortunately, also in some of the other studies, they have people with Alzheimer's that were being treated with the cholinesterase inhibitors, with memantine. And then they added to that combination, they added the methylene blue, and this doesn't work. These other compounds have actually detrimental effects when given chronically, and so you couldn't demonstrate any benefit under those conditions. And however, it is almost impossible to convince neurologists to take off these medications, people with dementia. So it becomes nearly impossible to do a trial with only methylene blue nowadays. So this is one of the issues. So, but what happens then? This is the sinister part of it. A lot of pharmaceutical companies didn't want methylene blue to come into the picture because they couldn't patent it. They couldn't make money from it. It's very inexpensive to synthesize. It used to be widely available. Not anymore. Why not anymore? Because they influenced the FDA to say, wait a minute, why you're not regulating methylene blue? Methylene blue is a grandfather drug. In other words, being around for decades before the FDA was created. So drugs that were safe and used for decades before the FDA grandfather. So they put a lot of pressure, and now anybody who wants to do anything with methylene blue, the FDA requires these investigational new drug applications, and makes it very difficult. And so all of the studies that we did with humans, we had to obtain for each one of them, do the process again, an investigational new drug application demonstrating the safety and demonstrating the advantages of the compounds.
That seems ridiculous, just in terms of the amount of loopholes and regulations that you have to go through in order to make this happen, when in fact it's been around, as you say, decades before the FDA was even a thing.
It's been around over 120 years, and it used to be available over the counter. And this is something that I need to explain for your viewers. Methylene blue can have different degrees of purity.
Yeah, let's go into that, because that's something that's very important, so people just don't go and buy the aquarium stuff.
Yes. In fact, like I told you, with the high concentration, it has an antiseptic activity, like I explained in the case of the bladder, the urinary infection. It also is used in higher concentrations, actually taking up orally with people that have parasites, especially the malaria parasites. Right now, especially the Germans are the ones giving usually thousands of children in Africa with malaria and other and they also have all kinds of intestinal parasites. They're given methylene blue in concentrations from 7 to 10 milligrams per kilogram orally, and they act as an antiseptic, and they weaken one of the enzymes of the malaria parasites called the Plasmodium falciparum, and it's being used for that purpose. But they manufacture their own methylene blue and provide it free, as in campaigns has anti-malaria, anti-parasite campaigns. Just give it acutely for several days, usually 3 to 4 days. But that is pharmaceutical grade methylene blue, which is about 99% purity or more. It doesn't have some of the contaminants that are present when you synthesize chemicals. Some other compounds are also formed in small amounts, including mercury that you mentioned. But for industrial purposes, there is a more inexpensive way to manufacture methylene blue that has still about 95% purity. And so right now there are 3 grades. The pharmaceutical grade that is about 99% plus purity. That is the one that you get injected in the emergency rooms for as an antidote. Then you have the one that is called the chemical grade, methylene blue, could be 95%, 96, 97%. This is the one that you can buy from, it's called chemical grade, to use in the chemistry lab for making stains, reactions sold by chemical companies. And then the lower quality in terms of purity is the industrial type, which could be, it could be 90% or less purity that has a lot of contaminants, but it's good enough to dye clothes or dye some other compounds, some other materials.
But the danger there is obviously the fillers, right? And so
yes, the danger is these other compounds are formed when you synthesize methylene blue and you don't have the purified form. So usually either the chemical grade or the industrial grades are the ones available, for example, in the pet stores that you use for fish. If fish have any problem, actually any problem, any ectoparasites, that is parasites are around their surface, or microbes, microorganisms that are trying to eat them up, literally, then you pour methylene blue into the water. And it's a relatively high concentration, but of course it's going to be, the concentration is going to be higher to that external part of the fish. It will provide this antiseptic function. And the amount that the fish consumes they just consume some of the water, is not enough to be harmful. So it's more beneficial. So every pet store in the world has methylene blue bottles. However, they are either chemical grade or industrial grade, and you don't know. They won't tell you what concentration level of purity you have. So you have to buy methylene blue from a source that is pharmaceutical grade. And there are 2 standards. One is called the USP, or United States Pharmacopoeia, the pharmaceutical standard. That's the highest one. In other words, they require more purity, less concentration of certain of these contaminants. And then the other standard is the European pharmaceutical standard. And it is also good quality. It's just that they allow slightly more concentrations of certain contaminants. And for example, the ones that the Germans use when they go to Africa in these anti-malaria campaigns is the European one. And in the US and Canada, they use the USP. USP is a pharmaceutical grade in the US. Some companies in Europe, because they want to sell to the US and Canada, they manufacture USP grade methylene blue as well. Even though they're European companies, there's one in France, that actually came up with a new way of synthesizing methylene blue that is virtually free of contaminants. It's the most
Fascinating.
pure form available. And they were able to patent the method for the synthesis.
Hmm.
So that means they're asking much more money for the methylene
Of course
blue
they are.
than what you can get through the classic pharmaceutical grade synthesis.
But pharmaceutical grade, suffice to say, is good enough to
Oh,
do.
it is safe
Okay.
and is given, like I say, is injected.
Hmm.
Uh, there are people who have deficits, for example, in cytochrome oxidase that I told you,
Hmm.
that are born with these deficits. There is one disease, it's called Leber's syndrome.
Hmm.
Uh, the full name is subacute necrotizing uh, leuconeuropathy. That
Say
is
that one 5 times fast. Wow.
but yeah, that one means cytochrome oxidase is not fully functional,
Hmm.
and so their brain starts degenerating,
Hmm.
uh, and they take methylene blue all their life
Hmm.
uh, to be able to keep functioning. So it's not only being used acutely as an antidote, but in this particular, this unfortunately, that's a rare, or fortunately, is a rare condition. Uh, but they can take it every day for the lifespan in order to be able to use oxygen.
So I
Uh,
think that answers my question over long-term use concerns. I guess there's no long-term use concerns that we know of.
no,
Okay.
there is uh, right now in the U.S. in particular, there's a new class of drugs that became at some point the most prescribed drugs in the U.S. And this is the antidepressants that are called the SSRIs,
Hmm.
the selective serotonin reuptake inhibitors. Uh, if you're taking SSRIs,
Yeah, you shouldn't
this
take.
is a counter indication with methylene blue because methylene blue actually has itself an antidepressant is a mild, but it's been demonstrated in clinical research, a mild antidepressant action.
This is
Uh,
the MAOI properties, or is that something else?
yes, it is primarily, but not exclusively, because part of depression involves fatigue,
Hmm.
low energy. So methylene blue fights this
Ah.
out through improving energy consumption. But also methylene blue at low doses, it inhibits some of the action of that enzyme that is called MAO,
Hmm.
monoamine oxidase. So monoamine oxidase inhibitors are a classic class of antidepressant medications.
Hmm.
So for example, St. John's wort,
Hmm.
a herb that has some antidepressant properties, is a MAO inhibitor. Uh, so, so the FDA has a warning not to use methylene blue together with SSRIs.
Hmm.
Uh, However, the problem is not the methylene blue, the problems are the SSRIs. Methylene blue by itself is completely safe. And
Hmm.
let me explain that FDA warning. Uh, all medications have some kind of FDA warning.
Yeah.
Uh, uh, and they didn't have one for methylene blue before, but there is a situation where methylene blue is used at higher concentrations and is during surgery in the neck
Hmm.
for removing the parathyroids. These are small glands next to the thyroids that are embedded in the fat, subcutaneous fat inside the neck. but it's very difficult to be visualized by the surgeons. So when the surgeons cut through the neck, they want to see where the parathyroids are to remove them. They pour methylene blue into the wound.
Mm-hmm.
And the most active tissue there between the fat and the gland is the gland. So the
Mm-hmm.
gland, then they the tissue, and they see that the one that is stained more is the gland tissue. And
Mm-hmm.
then they can remove it. And then they repeat this several times until they know they remove all of it. So this is an uncontrolled use of methylene blue, because now that methylene blue is getting the circulation in an open wound. And they never had this problem with this technique. Actually, they've been doing that technique since the 1970s. Uh, so it's, however, when people were taking these SSRIs, were anesthetized, their brain function was depressed, and were then given these large concentrations of methylene blue, then when they were recovering, they found increases in serotonin, leading to serotonin syndrome in several of these cases, and this led to the warning.
Mm-hmm.
However, it has never been seen if you don't have those three conditions.
Yeah.
A group of surgeons, pharmacologists in the Mayo Clinic wrote a rebuttal to the FDA saying, this is not right. You are warning general for SSRIs when it's only under these specific conditions that happen. And they present evidence that in the majority of cases, even under those conditions, it doesn't lead to any adverse effect. So that's the only negative side effects. You can check out, there are some people that have some enzymatic deficits
Mm-hmm.
that have to do with urine, being able to excrete compounds through urine, you know.
Mm-hmm.
So in that case, then you cannot excrete your methylene blue properly, so your levels can build up inside your blood. So there, in that rare situation, then you can have problems. So if you have a urinary tract, urinary diseases that doesn't allow you to excrete the methylene blue will build up in your
Mm-hmm.
blood.
Mm-hmm.
So that's essentially, we had to worry about all of this when we did the human trials to
Mm-hmm.
make sure that people didn't have these issues.
Dr. Gonzalez-Lima, I just looked at the time and wow, it's flown by. And I didn't even get to the second topic that I want to ask you about. So I'd like to invite you back for a round two at some point. But I do have a final few rapid fire questions, if it's okay with you, to just
Sure.
round off our conversation. Um, First question, what's your top trick for enhancing focus?
What is my what?
Top trick for enhancing focus.
Well, I don't do tricks like magicians, even though methylene blue is called the magic bullet.
Mm-hmm.
I don't think it's magical, but definitely methylene blue is preferred because some of the other ways to increase brain functions, for example, are based on two things: boosting energy availability
Mm-hmm.
or neurotransmission. In my view, the weakest ones of these are neurotransmission because these are very transient changes, and they produce all kinds of other side effects.
Mm-hmm.
There is no neurotransmitter that is specific to, for example, cognitive function.
Mm-hmm.
They serve many different cellular functions. So things that improve energy and energy availability, use of oxygen. Uh, of course, everybody knows that aerobic exercise will produce improved cognitive function. Why? The main reason that aerobic exercise accomplishes this is number one, it upregulates cytochrome oxidase, not only in your muscles, but in your brain. And it increases your cardiovascular health so you can get more cerebral blood flow. And we have actually seen that it's very similar the way exercise works by facilitating mitochondrial respiration. So there are other compounds that you may probably hear about. Acetyl L-carnitine is a compound that is involved in mitochondrial energy production, so it can serve as a precursor there. So it can facilitate adding more substrate. But again, the limiting factor, even if you have enough substrate, if you're breathing enough oxygen, is always cytochrome oxidase. It doesn't allow you to use that. And if you cannot provide more energy, brain function is tightly coupled with energy use. So the more you are working your brain, the more energy is like the brain is plugging to the wall in an electrical supply. You unplug it and it stops working. You don't provide oxygen, stops working, and you die, pass out and die. But if you're working more, you're more electricity, you're drawing more energy. So I would say I prefer to recommend people the aerobic fitness and substrates like acetyl L-carnitine that facilitate creation of natural electron donors. And what we didn't talk about here, photobiomodulation or
Dr. Gonzalez-Lima, I'm going to have you back because that is one topic I would love to drill down more. I know we don't have enough time to do it.
Yes, that would be another way to facilitate the same mechanism.
So what excites you most about what's going on in the health world right now?
Well, unfortunately for everyone, we are now being under attack by this pandemic, suffering from COVID-19. So the crisis from a health point of view happens when you develop pneumonia. So we need to find ways to prevent the formation of the pneumonia. Even if we are exposed to the virus, which is likely, most people are going to be exposed and are going to get the virus. So my concern would be, how can we prevent the pneumonia? I don't think vaccination is the way to go. This is something that this virus transforms itself so quickly in a rate similar to the cold virus. It's like we don't have a vaccine for the common cold. We're not going to have an effective vaccine for the SARS virus that produces COVID-19. It will be more of a psychological safety blanket because the virus is going to change. So I think the focus should be on preventing the pneumonia, having self-protective. And it just happens that methylene blue may be one agent that could do this in the lung. There are dozens of studies, including the majority human studies, showing that methylene blue can be cytoprotective for the same reasons that I told you, preventing the oxidative stress and damage and facilitating energy utilization by all the tissues such as the lung. And in animal experiments, unfortunately, there's only one really well-detailed animal study where they experimentally induced pneumonia. And they give methylene blue in the same way that I just explained here. and they can prevent the pneumonia and the lung damage. And they show you the tissues from the animals and all the measurements of, but it hasn't gone beyond that. So I wish there will be some groups interested in doing this. Unfortunately, again, pharmaceutical companies are not going to be interested because they won't be able to patent this intervention. They will be able to patent any vaccine. And for example, the FDA has have a very low threshold of effectiveness to approving a vaccine. Right now is 50%. So it's almost by chance. It's 50% effective in people infected to prevent or reduce severity of the disease with the vaccine.
It could almost be placebo, right? Like that could almost be a placebo effect in itself.
It's unfortunate, but that's going to be the first time around. The main concern is that it's not that it's only 50% effective, but it's not that it doesn't cause any harm. Because
of course,
some of these will cause harm. Unfortunately, proteins in our body, just like the microorganisms, share commonalities. And when you develop any antibody against any protein or part of a protein, there is going to be some cross-reactivity. There is no such thing as a vaccine that is completely specific and has no cross-reactivity.
Yeah.
So the important thing would be to avoid adverse effects. So I'm hoping that something like Methylene Blue will attract some other governments that it may have to be done by non-profit organizations or government organizations. Right now, they could easily do it when the patients are coming in. They have it in every emergency room. Absolutely. As soon as they go into the emergency room, they can be put up in Methylene Blue. And it will facilitate oxygenation, even if the lungs are compromised.
Dr. Gonzalez-Lima, perhaps more of a personal question. What book has most significantly impacted your life?
Can you repeat the question again?
Yeah, sure. What book has most significantly impacted your life?
Yes, I have to say, based on these topics, that it is a book written by Dr. Jack De La Torre.
Okay.
And this book is about Alzheimer's disease. And it talks about a new paradigm, how this should be viewed. I don't recall exactly right now the name of the book.
I can find it and put it in the show notes.
Yeah, it's a book about the vascular hypothesis. It's about prevention of Alzheimer's disease, focusing on the vascular hypothesis and ways that we can do to improve our aerobic health through the cardiovascular system, but also in other ways that, and it shows all the evidence there of why the amyloid and the tau are not what we should be focusing on, and how we should focus on vascular health and other mechanisms that facilitate mitochondrial respiration, including what we have been talking about today. And so I think it's Alzheimer's turning point. It's a new way. I think this will have a big impact on society, and it needs to be used as an antidote for all of the misinformation that has been going on for so long now about Alzheimer's disease.
Thank you. Dr. Gonzalez-Lima, where can people find out more about you?
I think the best way is doing a Google search. I have a lot of my work in a German system that is called ResearchGate.
Mm-hmm.
ResearchGate has over the profiles and papers of more than 17 million researchers in the world. It's freely available. You only need to register for it, and they is not a commercial type of enterprise. So you search my name in ResearchGate, and in addition to my profile, there a very brief profile, you have access to many of my publications. Some of them are copyrighted, and the publishing companies do not allow you to have them freely available, but many of them are already open access.
Amazing. This has been such a pleasure for me. And like I said at the beginning, I've wanted to talk to you for a very, very long time. And this conversation is incredible. And we only got to cover methylene blue, but I'm so glad that we went into such detail. So thank you so much for giving so much of your time today to talk about this topic. I really appreciate you.
Thank you very much, Boomer. I really appreciate it.
And to everyone listening out there, you can check this one out on YouTube or every other podcast channel. But it's been an amazing time. I hope you enjoyed it.